Okay, I think I'm going to get us started. I want to respect everyone's time. I'm sure we'll have some people trickling in over the next few minutes. Welcome back to the Wildfire seminar series here at Stanford for the winter quarter. Thank you for your patience as we all navigate this strange time of the pandemic and the Omicron surge. Just first, an announcement. We are tentatively planning to go hybrid next week. Please stay tuned to the usual channels that you learned about the seminar series through mailing lists, but the intention is we will make this available next week, unless the university tells us otherwise and backs off on what we're doing with classes. We intend to have a live speaker and a live audience in Sri Ram 104 next Wednesday, January 26th. For those of you who feel safer doing this via Zoom and or cannot be on campus, we will also try to juggle the technology and make this available by Zoom. So please stay tuned, but the intention is to have our next speaker, which is actually Andy Abranches from PG&E. He will be speaking, our third speaker of the quarter. We expect to have him live on campus next week on the 26th in Sri Ram 104 at this time at 12:15. So stay tuned. That could change, but that's the hope. And we hope obviously everyone will be safe. So please come masked up, etc. Please come with your questions. Again, I want to acknowledge the Bill Lane Center, Woods, Precourt, and Stanford Center for Sustainable Data Science for their support of this workshop. And for the students in the audience, I encourage you to get in contact with me and be on the lookout for announcements soon for registration to be part of the Wildfire Challenge as part of the Big Earth Hackathon during spring quarter. There's a course, you can earn units for it, as well as participate as an extracurricular activity. But with all those announcements out of the way, I'd just like to say we are pleased to have Dr. Mary Prunicki as today's speaker. Dr. Prunicki is Director of Air Pollution and Health Research at the Sean Parker Center for Allergy Research at Stanford. Dr. Prunicki received her PhD from Northwestern University and her MD from Southern Illinois University. She leads studies which investigate the impact of air pollution and wildfires on immune health. Her goal is to use the research findings to both educate and shape policy. I've known Mary for a few years now, and I think she brings a high level of both empathy and compassion for those struggling with poor air quality, and similarly, a passion to understand the effects of wildfire smoke and how it affects human health. Today, she will speak to us about the interconnections and connections between climate change, wildfire smoke, and human health. And I'm sure you will thoroughly enjoy her talk. Thanks for being with us, Mary.
Thank you. Thank you for having me. Let me go ahead and, can I share my screen?
Yes, please.
I think it wants, okay. Okay, can everybody see it? Yeah, okay, great. Thank you for having me. Today I'm going to talk about climate change, wildfires, and the impact on health. And I've tried to pull together studies done within the past year or so. There's kind of been an explosion in the number of studies looking at wildfire and health, which is good. So I'm going to touch upon a few of the newer studies, and I have the citation in the slide so that if you want more information, you can find it, or feel free to contact me if you can't find the study itself. So the WHO and other organizations have said that climate change is the single greatest health threat facing humanity. I think there are so many ways that climate change impacts our health that typically we don't think about. I'm going to touch on air pollution because obviously wildfires are a part of that, but there's other.
Mary, sorry to interrupt you. I think you have your displays flipped. I think we're seeing a presenter view.
Okay.
Or maybe swap displays. Maybe that's what it would be. There you go. Great.
get rid of this. Okay, is that good? Okay, so there's many ways that climate change impacts our health. There's both obviously direct impacts when we talk about extreme weather, increased heat and things like that. And then there's indirect impacts such as overwhelming our water systems, loss of homes, mental health issues, decrease in crop yields, changes in vectors, things like that. So I'm going to talk a little bit about air pollution in general, and then move into specifically to wildfire studies. So the relationship between climate change and air pollution, they're closely tied. Some examples are the fact that our pollen season is changing due to climate change. The increase in heat has not only lengthened the length of pollen season, it's made the pollen itself more allergenic. We'll obviously spend most of our time on wildfires. Ozone is another pollutant that we have to worry about, and especially the combination of ozone and particulate matter. So as we go through these slides, you'll see some interrelationships. This is just a study out of the JAMA looking at older adults and just showing ozone in general is associated with increases in mortality in older adults, especially those 85 and older. They also looked at particulate matter, and it's a similar relationship in that the older population is more at risk when they're exposed to different types of pollutants. The reason that PM 2.5 is so important, we're going to discuss in a minute. But we know that, especially after the 2020 fires, which several of the studies I'll mention looked at the impacts of that, over 46 million people were exposed on one day alone. And we also know that when we see increases in particulate matter and also ozone simultaneously, it has a greater impact on our health. So with wildfires, about 80% of wildfire smoke is particulate matter, 2.5 microns or smaller. The smoke also contains toxins, other types of pollutants, gases, VOCs. And what we know is that if we're talking about particles 2.5 microns or smaller, they're small enough that they can go all the way down into the base of your lungs and actually cross over into the bloodstream and then cause, impacts with systemically in different organ systems. And here's just a schematic showing how the black dots represent the particulate matter. It can come all the way down into the base of your lungs. And when you get down to the level of the alveoli, they're lined with epithelial cells. And then we have different immune cells, such as the macrophage and the dendritic cells in that area. And they take up the particulate matter. And this has several different types of impacts on the immune system. And this is just kind of a cool image showing the gray circles are macrophages. So, and they are uptaking the black dots, which are the particulate matter. And, this causes widespread impacts, but at a very basic level, it makes these macrophages, which help us fight infection, kind of tied up and not as effective because they are dealing with this particulate matter. So we also know from various studies that the wildfire smoke is not equal to PM 2.5 typical air pollution. Typically, the smoke has even smaller particle sizes. It has, as the smoke ages, there's an increase in free radicals, so it makes the smoke more toxic. The smoke impacts are amplified with high temperatures and ozone, like we mentioned. And we know, just like in the lab, that particulate matter is more toxic to those macrophages I just showed you when compared to particulate matter from normal air pollution. And last year, there was a study out of Southern California showing that that indeed wildfire smoke is more toxic than air pollution. And they looked at emergency room and urgent care visits in San Diego County for 6 years. They looked at only those age 19 and younger. And they looked at kids when they came in for any type of respiratory disorder. And then they associated it with the level of PM 2.5, whether it was due to wildfire smoke exposure or other sources such as traffic. And what they found is that when kids inhale the wildfire smoke, that PM 2.5 was about 10 times more harmful than other sources of PM 2.5, especially for the younger kids. So I think this is a real eye-opener for everyone to demonstrate that the smoke itself can be extremely dangerous, especially to young children. And not only young children, you know, babies are even in utero impacted by climate change, by wildfires, by increased air pollution, and then also by the indirect effects when the mother is exposed to different environmental insults. And so we know both on a biological level and looking at health outcomes that pregnant mothers and their offspring are definitely impacted by lots of factors associated with climate change. This is another study showing that looking at child mortality, especially in low and middle income countries, and they associated level of income with smoke exposure and mortality rate. And what they found is that even a 1 microgram per cubic meter increase in a PM 2.5 from a fire was associated with 2 to 31% increased risk of child mortality. And the 5 countries that were impacted the most were the Democratic Republic of the Congo, Nigeria, India, Uganda, and Indonesia. So unfortunately, in other parts of the world, the impact of the wildfire smoke seems to be taking a huge toll on child morbidity and mortality. And this study was done by our own Marshall Burke and group here at Stanford. And he was able to show that there was an increased risk of preterm birth when the mother was exposed to smoke. And the risk was dependent upon the trimester, and in addition to the intensity of the smoke and the combination of the two. So I think this is a really good study showing that no one, not even in utero fetus, is prevented from being harmed by what's going on with wildfires and climate change. So this is just some of the older studies that have shown without a doubt that we are impacted by wildfire smoke in terms of our respiratory outcomes. It's well known that increases in asthma exacerbation will occur when someone is exposed to to smoke, especially if they're older or very young, or they have pre-existing conditions such as asthma or COPD. Other types of respiratory problems such as acute bronchitis and pneumonia also increase, even if it's just a 10 microgram per cubic meter increase in PM 2.5. And this is just one of those studies showing that, sure enough, during a wildfire, there are increases in asthma exacerbations, especially for children. And if you look at the AQI, that was a 100 to 150, and we all know we experienced far higher AQIs in the fires of 2020. When we talk about the impacts on the cardiovascular system, there's more and more data to support the fact that there are multiple types of cardiovascular insults with exposure to smoke. There's increases in heart attacks, arrhythmias, heart failure, pulmonary embolisms. There are various different mechanisms that are responsible for this, and some of this we're also studying in our lab and in conjunction with the cardiologists here at Stanford. One study, for example, again found with just a 10 unit increase in PM 2.5, there's an 8 to 18% increase in mortality. Those especially at risk are those with pre-existing conditions and the elderly. The wrong way. And this is just one of those studies by Wetstein showing he looked at different fire events in California in 2015, and he demonstrated that the risk was greatest for the elderly, with an increased risk of heart attacks, similar to if you were smoking 2 cigarettes per day for a year. So the impact of the smoke, has definite cardiovascular outcomes. And this is the same study showing that all-cause cardiovascular is increased, especially with heavy smoke density. And also all-cause respiratory, especially for those older adults, which are the blue, those 65 and older. I keep switching, sorry. This study was interesting. It looked at not ER admissions and urgent care visits. It looked at a different database that for out of hospital cardiac arrest, and sudden cardiac death is when someone's heart just literally stops beating and they just drop. And a lot of these people don't make it to the emergency room. So they weren't previously tallied in some of these studies. And this study done in California found that, smoke exposure does increase the risk of sudden cardiac death, especially in those 65 and older. The data actually went down to those in their 30s being impacted, though, it's quite eye-opening. And then, of course, there's studies with firefighters showing that exposure to the smoke will increase not only lung cancer, but also cardiovascular disease. And we work with firefighters in the lab, and one reason we're so anxious to work with them is because their life expectancy is decreased from being exposed to the smoke so much. Some estimates are as much as 10 years. And the EPA recently put out a study looking at the impact of climate change and vulnerable populations. And what they found is that there were 4 most vulnerable populations that are most impacted by climate change. So those would be those of low income, minorities, those with no high school diploma, and then those 65 and older. And the different colors represent which type of impact they were looking at. So if you look at the yellow, that is the air quality. And you can see that, you know, it's air quality for children, so ignore the 65 and older, but all the other groups are definitely, you know, significantly impacted by worsening air quality associated with climate change. In addition, extreme temperatures impact 3 out of the 4 groups. And so one of the interesting things that this study looked at is they estimated how many elderly people, 65 and older, would experience premature death if we had a 2 degrees Celsius in global warming versus a 4-degree Celsius increase. And as you can see by the increase in the red between the 2 maps, just a 2-degree increase in global warming will result in a significant number of increased premature deaths. And that's estimated from the effect of the PM 2.5. I believe I also have one on heat, increases from heat itself too. This study I wanted to put in here because it addresses mental health impacts, which, you know, there have been some studies obviously showing that when someone is exposed to the trauma of a wildfire, there are increases in mental health outcomes such as post-traumatic stress disorder. But in this study, they looked at the association between wildfire events and the pandemic. And they did so by monitoring a crisis line that people text. And they looked up, they monitored certain, you know, code words, looking at people who were suffering any type of mental health impacts. And they used the subjects basically as their own control. So they had, as you can see from the graph on the right, prior to the red dotted line, which is the start of the wildfires last year, there was already a significant increase in the use of the crisis line for mental health outcomes. And during the fires, overall, they did not see an increase, especially post-fire. Their conclusion was that people were already in crisis from the pandemic when the wildfires hit. And I think, you know, and so it kind of, it was kind of a mixed bag because you have the two extremes happening together. But I thought this study was important because it shows kind of a neat way to assess mental health impacts during a wildfire or any other type of disaster. They found at the P less than 0.1, so not 0.5, but 0.1, increases during the wildfire period of self-harm, stress and anxiety, relationship issues, and abuse. But they also, after the fire, found a decrease in suicidal thoughts and bullying. And they think that this is just basically illustrating that the pandemic has had a much more severe impact on mental health for the younger population, and the addition of the wildfire did not significantly alter their baseline. So, and this study came out last year, and it's a study out of Harvard looking at the association between wildfire exposure and the number of COVID-19 cases and then deaths. They looked at 92 counties that were impacted by the 2020 wildfires. And what they found is that there is definitely a relationship between exposure to the PM 2.5 during the wildfires and increases in the rates of COVID and in the number of deaths from COVID. And they found that this impact was seen up to 4 weeks after the fire. This isn't really surprising based on prior studies. There's been a study was done in Canada that looked at a community that was exposed to wildfire smoke, and then they looked at their rates for influenza that following fall and found it was increased compared to communities that didn't experience the smoke. And there's been other studies showing an association between air pollution and COVID rates, but this is the first study really looking at wildfire PM 2.5 associations with COVID. And based on what, we know that the wildfire smoke is more toxic, it makes sense that there's these, direct relationships between exposure to the smoke and susceptibility to COVID. And this study just came out. In fact, I couldn't even get the actual study, but I included it because it's kind of leading into the type of research that we do here on campus. But they looked at more neuro impacts from the smoke. They took a mobile lab and looked at mice and looked at their inflammatory responses. They had the mice exposed to the actual smoke from one of the sources of fires in 2020 from California, Arizona, Washington. And for 20 days, these mice were exposed to at least 4 hours a day of the smoke. And what they found was neuroinflammation. So they found some of the same immune markers that we have found in our own research with the VCAM. In addition, they looked at glial activation in the brain, and they found that some of the biomarkers that are used to protect against aging were actually decreased by the smoke. They also found an increase in amyloid beta, which is associated with neurodegeneration. And so this is the first study that I've seen of this kind. And, they found that neuroinflammation does cause age associated impacts. And so this kind of dovetails into our own research on campus. Right now, we're working on putting together a manuscript in which we obtained baseline blood in the fall of 2019 of just people on campus in the Bay Area. And then we waited for a fire to occur. And so that was the fires in the summer of 2020. And 15 people came in to give a repeat blood sample after the fires had been going on for at least 2 weeks. And then we compared within subject the biomarkers in someone's blood at baseline and during exposure. And so these aren't firefighters, these aren't people who are out and about, for their job, constantly being exposed to the smoke. These are people typically like you and I. They may have been out in the smoke some, they may have been using a mask, they may have been using an air purifier at home. But regardless, we were able to see changes in their biomarkers from that smoke exposure. And the figure on the right shows different biomarkers. The blue dots means that there is an increase in those types of biomarkers with exposure to the smoke. The red dot means there was a decrease. And what we found overall in our research from a couple different studies is we are beginning to be able to associate different inflammatory pathways and other types of key biomarker pathways with smoke exposure, and compare that to what we see with chronic air pollution exposure. And our next step is we're working on looking at a firefighter's blood before and after a fire and do the same type of analysis, because obviously we expect more dramatic results from that population. And this is the same group of 15 people, and this is just preliminary data, but it's showing on the top is mercury. We can see that the blue are the baseline levels of mercury in the blood, the red or the orange are post-exposure. And so it's possible that the wildfire smoke did contain mercury. And on the bottom, it's antimony. And there have been studies published where they've analyzed the smoke itself and have seen an increase in these heavy metals in addition to other ones. So this is one area. This is one area of our research that we're trying to focus on with other groups also on campus, Scott Fendorf's lab and others. And so this is how I open the talk about climate change really is a huge health threat and something that needs to be addressed in terms of our health as much as possible. And the research continues to pour out on how our health is impacted negatively by climate change and all the direct and indirect impacts that come along with it. And this is our group. And if you have questions, I'd be happy to take them, or happy to go over any of the other studies that I didn't have slides for that may be of interest.
Well, that's great, Mary. Thank you so much. Open the floor to questions. I think we got a small enough group, so feel free to just speak up and unmute yourself. If you're really shy, you can post your questions on chat, and I'm happy to share it with the others.
I should also say that there's a lot of groups obviously working on campus, even just for the health impacts of the wildfire smoke, in addition to all the other components with the wildfire research. So it's a problem that's going to take a lot of people to try to tackle, to figure out what's happening at the biological and at the biological level, and with the populations.
All right, we do have a question here. How soon should we take our young children and leave the Bay Area?
The Bay Area has relatively good air quality in comparison to at least to the Central Valley, where we typically have done our research with chronic air pollution exposure. Our area in the Bay tends to blow downward towards the Central Valley, and the air there becomes stagnant because it sits in like a bowl. And compared to at least the Central Valley, we are doing pretty good on air quality. I took out a slide that shows the direct relationship between PM 2.5 exposure globally and life expectancy. And United States, on that graph, is only estimated to lose between, I think it's 4 to 5 months of life expectancy based on how much we're exposed. when you look at other countries in the world, some people lose up to 2 years of their life just based on PM 2.5 exposure. And that was from a few years ago. I'm sure it's gotten worse now with the increase in wildfires.
I'm thinking Kylie's question, which is, I think, sort of, I'm not sure, a dark humor question is, maybe during an event, I'm not sure Kylie can clarify, but I'm guessing like during an event, what should people do? I do know of neighbors that a couple of years ago, they raced towards San Diego. And of course, that there were fires down south. So they got another version of wildfires. But do you have any suggestions? Is that really if possible, is that a direction to take? Okay, wildfires are going, let's go to, I don't know, somewhere that is cleaner air. Is that?
I mean, I guess, if people have the means to do that. But the fact is the smoke blows across the United States now, right? So the fires of 2020 ended up on the East Coast. So I'm not sure, how you're gonna, it would be nice if we had a better prediction model so we could all go to wherever that is. But that is also part of the reason that the underserved are so vulnerable, because they don't have the luxury of doing something like that. I think, as much as we can prepare and at least have a clean air room in our home, if actually picking up and going isn't possible, is something to think about.
Great. That, and actually, one of our audience said that their family in Michigan had a greater impact this year. And I remember reading the New York Times, there was an AQI over 200 due to the Oregon fires this past year. So I guess you can run, but can't hide, maybe.
Right.
Nina has a great, go ahead, Mary.
Yeah, and as the smoke travels, remember, it's becoming more toxic. So, I think more work probably needs to be done looking at the toxicity of the smoke itself, but the aging of the smoke is obviously a problem. So if it's blowing across, pretty much everybody, I think, needs to be educated on exposure to smoke at this point, given how our world is going.
Well, what a great segue into the question that Nina has here. She says, do you have a sense of whether the public in California is aware of the extent of the health risk associated with wildfire smoke?
I mean, I'm sure there's been surveys, and it depends on which population you look at. I know in the Central Valley, just anecdotally, I've talked to people and they said they have much higher concerns, much greater concerns that, they're used to the poor air quality, and even though they get exposed to the smoke, they're not as worried about putting on a mask or making sure the air is filtered. But I think it just depends on the population you're talking about. I don't think people are aware that like this new research on especially kids ages 0 to 5, that they're much more impacted by wildfire smoke than that same level of particulate matter from air pollution.
Yeah, I guess sort of a follow-up question, I guess, pleading my own ignorance. I've heard you speak a number of times, and I today just finally caught that, wow, the smokes gets more toxic in time. So is there anything being done? Maybe our government, is there anything being done to really educate people? I mean, these are things that we've got a bunch of heady people in the audience that really want to dive into the details and learn about these things, but how do we educate the public? Because I think the vast majority of people do not know, let's say 80% of what you talked about, and that may be being generous.
Yeah, I mean, I know there's a push to educate people. I know the American Lung Association is becoming more involved in, wildfire education. I think compounded with the pandemic, though, I think it might be hard to make that message hit home as it should. But I mean, there are, especially, the American Academy of Pediatrics and other organizations that are trying to educate, but I think there's certainly a debate on what's the most effective way to do that education and reach the most vulnerable populations that actually need that information the most.
Sounds good. Other questions from the audience, either chatted or please feel free to speak up. I'm sure Mary would like to see a face and hear another voice besides mine. Well, I'll add at least one more question, I guess, aligns with what we've been talking about. So you said, I mean, and we all know climate change is the big driver of most of this, right? So outside of, obviously trying to cut emissions, et cetera, from your standpoint, what's the thing, I guess, the public can be doing, or maybe visiting what Michael talked about last night? Where should we be investing our efforts beyond, like, obviously curbing greenhouse emissions and stuff like that? Where do you think our efforts, both as spending money and also educating people, where should the efforts be made to hopefully mitigate some of the very sobering things you shared with us today?
I would say focusing on children, the schools, educating through that route and making sure that people are aware that indoor air quality may not be good, even if you're indoors, that air quality might be as bad as being outside. And there's really no way to tell unless you're measuring it. So, if government funding, if the state legislature could use some of that wildfire money for assisting schools in becoming more educated on indoor air quality, or making sure everyone is equipped to handle a wildfire in terms of air purifiers, or whatever the short and long-term solutions are going to be. I think that would be a good place to start.
Sounds like a reasonable place to start. Education and equipping people. I haven't done the cost, like purple air monitors, how much it would cost for each school to have a couple of those indoors.
Move them around. I mean, because these kids, if they're impacted now, and does that set them on a trajectory to have increased asthma and allergies as an adult and other health problems? So I think it's really, really important to, I guess, keep the elderly inside, and then for the children, make sure that we're providing the best environment for them.
Yeah, and maybe, I guess, one of the upshots, although they're supposed to be disposable, and that's probably another question, but maybe these distributions of N95 masks for the pandemic, people will keep them, assuming we get out of the pandemic, people will keep these. I don't know that, again, people will talk about washing them or whatever, but it'd be nice if people do have N95 masks available during the wildfire season. So
yeah, there's debate on whether that increases, makes someone increases their risk, because they maybe would go out when they wouldn't have otherwise. For the mask itself, to have a really good seal is difficult. And, I've heard arguments both ways, but it's certainly better than nothing, right? If you have to go out.
Yeah. Other questions and comments from the audience here? I think a lot of people have found your talk, at least I think sobering is the right word. Laura.
I was just wondering, you've talked about all the details of this whole talk, but I was wondering if you could kind of summarize like the acute risk of wildfire smoke versus like the long-term risk of having been exposed to multiple wildfire events over the years.
Okay, that's a good question. That's a research, lifetime research goal in itself. So the acute risk are things like the asthma exacerbations, the cough, the headache, for an older person, a heart attack or a stroke, or, there's a study showing that if you have end-stage renal disease, your mortality goes up when you're exposed to smoke. So those would be more the acute things. If you're pregnant, your depending what trimester, your birth outcome. Long-term risks, it's one reason we're studying the firefighters and even retired firefighters, because we know long-term there's increases in cancer, decreased life expectancy, and that middle ground is what's not as well known. That's one reason we're anxious to finish this current study. a healthy person who gets exposed in one season to the smoke, we don't really know the long-term consequences of it, especially if they were more minor symptoms, so that's part of why we're studying this. Our centers now working with cardiologists and others looking at both air pollution and wildfires and how does it impact someone both short and long term and low versus high exposure. So unfortunately, there's no easy answer for that one. The extremes are known. It's the in between, which impacts a lot of individuals that's less clear.
Nina, I'm gonna hold you first. I have a question here, which we have time for. So Heather asks, do you need more people to study?
Volunteers, yes, certainly. We're always in need of control samples. The pandemic has really decreased the ability to collect, whole blood when you do actual blood draw. So we have switched to microsampling for some of the studies, which makes it really nice. You can mail a kit in the mail or mail it, and then the person does it themselves. It's a finger stick and mail it back. So I think the pandemic, the workaround has really kind of opened up the ability to recruit, but we're more than willing to enroll people as controls in any of the studies.
Awesome. Nina, you had a question.
Yeah, I was wondering if you could speak to your research looking at the health impacts of prescribed burns versus typical wildfires.
Looking at the prescribed burns, is that what you said?
Yeah, prescribed burns versus wildfires.
Yeah.
Health impacts.
Yeah. So our research, we published a letter to the editor looking at retrospectively at a group of 6 to 8-year-old children living in the Central Valley. They always get fires because they're close to Yosemite and they get the winds from LA too. And so we had collected a lot of blood from these children, and we looked back at those who had been exposed either to a prescribed burn in Yosemite versus a wildfire. And we tried to compare two groups that were exposed to fires of about the same size, about 30 days prior to a blood draw. And what we found is that the prescribed burns were less detrimental to the immune health. We saw a lesser degree of change in the immune genes that we typically see, like, for example, with air pollution in the prescribed group versus the wildfire group.
Thanks for the answer. Yeah.
We also did a study with teenagers living in Fresno and looked at their blood when they were exposed to a wildfire. So that was a wildfire 60 miles away, and we could see changes in their biomarkers in their blood, and these are healthy teenagers. And what we don't know is, does that set them on a different path as an adult for chronic either respiratory or cardiac conditions or other types of inflammatory conditions? We don't know.
Very sobering things and a lot of questions to be answered. Like I think Mary says, she's got a career still ahead of her to figure some of these things out for us. We have time for a couple more questions, actually, if people have them. Well, as I said, I think, Mary, thank you so much for sharing. I think very sobering, the stuff you shared today, and this shows why the work you're doing is very important and why we need to educate people and spread the news and all get involved in some way to help mitigate climate change and inform ourselves about steps to protect ourselves, our loved ones, and the vulnerable, not just people we know, from such a disastrous situation. But thank you for your time. As Mary invited, please contact me or her if you have any follow-up questions. I'm hoping to solicit some questions from her for our hackathon, because I think some of the things she's raised are suited to getting creative students to working on the problems in the spring. So yeah, let's keep the dialogue going. And I'm glad to see such a diverse audience with us each week. I should note that next week, again, we are hoping to be live. I don't promise, but we're planning to be live and on Zoom. So if you want to be safe or can't make it live, please join us on Zoom with the same link. But we're hoping to be in Sri Ram 104 next Wednesday. And our third seminar speaker will be Andy Abranches, who heads up the wildfire risk division at PG&E. So a very different perspective. Hopefully people will be friendly, because I think, you know, people have mixed feelings about PG&E, but I'm looking forward to PG&E's perspective on what they are doing and what they're thinking about in terms of wildfires. So again, thank you to Mary for her time and sharing her insights, and thank you all of you for the great questions. And we hope to see some of you live next week, if not on Zoom. Have a great rest of your week and stay safe.
Thank you.